Hi, I'm Charlotte Smith with Bladen Online. Thanks for joining us. We're here in the Commissioner's Room at the Bladen County Courthouse with Bladen County officials. If you will, whenever you start to speak, if you'll introduce yourself, please. And we'll start with Director of Health and Human Services with Bladen County, Dr. Terry Duncan.
Good afternoon, everybody. Just to give you a quick update on where we are in Bladen County and in North Carolina, if you haven't heard. Currently, as of the 11 o'clock North Carolina Department of Health and Human Services report, there were 636 cases in North Carolina with one death in North Carolina. There was an additional death, but the rest actually was Virginia, so that one would be attributed to the state of Virginia. As of yesterday, there were 29 hospitalizations throughout the state. As of right now in Bladen County, there are no hospitalizations with patients being tested for COVID, and there are no positive cases. To date, we have tested 27 people in the county, and we are awaiting 7 results. And this is as about an hour ago. We also want to make note that the flu, I just got the flu report for the last week, and the flu incidence is 5.25%. The baseline for our region is 2.4. So it is up from even last week, the flu prevalence. Mm-hmm. We are seeing an increase, as you can see from that with the flu, as well as we're seeing some strep and some sinusitis.
Okay, so can you speak to why the flu would be going up, why those cases would be increasing with all the social distancing and hygiene practices that are supposed to be in place now?
I really cannot speak to why itself. We just know that for the last 3 weeks now it has increased. It started the upward climb from about 3% going up to around 4 and now at 5.2.
Okay, and we had a question earlier. How many ventilators do we have in Bladen County?
The last that I heard, we had 4 ventilators at the hospital, and there are 4 ICU rooms at the hospital as well.
And are we running low on any supplies that you know of, any medical supplies that may need to be donated?
Folks in the community have really been generous and have done a lot of sewing of masks. We still are looking for, and Nathan can speak to this, the N95 mask, some gowns and some other things. But folks in the community have stepped up, and the guidelines actually say that we can use those hand-sewn masks. And to the community, thank you much for the generous donations from many, many people.
Okay, and if someone if they do have a donation to make, how would they go about donating?
I think they could either bring them to the hospital, to Tracy Priest, to the health department, for me, David Howell for EMS, the nursing homes. Here, both of our nursing homes would be in need of masks as well.
Okay. Now, for the emergency services, you guys have been helping get the supplies to where they need to go and that kind of thing. What are you seeing out there as far as the emergency services side?
As far as, before I start, Nathan Dallas, Emergency Management Director for the county. As far as what we've seen, obviously in separate press conferences, we've mentioned that everybody's asking for the same thing: N95 masks, surgical masks. Those 2 in particular are on not only a North Carolina shortage, but a nationwide shortage. We put those resource requests in when we exhaust all local means to get those. We put those resource requests in up to the state. They are prioritizing those by healthcare agencies such as the health department, hospitals that are running a shortage, but we're having to give them extensive information because the supplies are so limited for burn rates, what they normally use, what they're currently burning at this time with the COVID-19 crisis going on. So we might put in a supply that we need for a week and they might only be able to fulfill it for 2 days. Mm-hmm. So they're certainly prioritizing as they get shipments in, they're coming out, but like I said, there's a shortage nationwide. We're expecting more shipments to come into the state and those to distribute those out. But as of right now, N95 masks are certainly not readily available, and if anybody in the public would let us know where we would be able to get those, like Dr. Duncan said, donations to the health department, hospital, EMS, they would certainly be appreciated.
Speaking about child care, emergency service workers needing child care for their children, and then the daycare workers there, the state just issued some new guidelines and an application that child care operations need to fill out by March 31st. Can you tell me what the daycare workers should do in order to provide the care that's needed? Do you think that we'll have a large demand there?
As of right now in Bladen County, I know on the news you hear of cases in other states. New York, New Orleans is getting ramped up today with cases more. Right now, we're not running on a shortage of child care that I know of for our essential personnel. And when I say essential personnel, we're talking nurses, health department, EMS, things like that. Certainly, if the daycares are encouraged to stay open, no one is forcing them to stay open. If they deem it necessary that they feel like they need to close for safety concerns. But we do stress, and Dr. Duncan probably alluded to this better than I can, we do stress if you are open, you need to be following the hygiene guidelines and sneezing and coughing etiquette that is all over the news and we've mentioned in the past. Readily cleaning surfaces with some kind of disinfectant and those things is what we ask.
Okay. And then for law enforcement and for our district attorney's office, I know that there was some talk about releasing people in the detention center during this COVID-19 outbreak. Can you tell us how the inmates are being taken care of at the facility and if there's been any released?
Well, as it relates to inmates in custody, I'll let the sheriff speak to that, and then I can speak more generally about courts and what we're doing.
Okay.
Jim McVicker, Sheriff of Bladen County. What we're doing, and we have done this from day one, we have a washing center set up outside of the detention center, and when officers bring suspects in, they're asked questions, their temperature is checked, they have to wash their hands thoroughly, and if they're admitted to jail, they're required to take a shower, which we do that all the time, and they change the clothes, of course. We have gone all extreme to protect our inmates, and the only thing we've really done, we've talked to the district attorney, we've worked very close with Quentin, and we're trying to keep and put as many people we can in jail, if it's where we can, and that's his call. He's going to make that call, not I. But as of today's date, we have 143 inmates in our facility, and we use the average 155. And of those 143, 60 of them are federal inmates who have been here for a while before this began, and 23 of them are misdemeanor confinement, which have been here before this began. So other things we're doing, our work release inmates are steadily cleaning all flat surfaces. Anytime somebody comes in, we make sure they abide by our rules. And if they have a temperature or any symptom, we don't allow them in the facility. We have 2 cells that are separate apart. If someone does show you symptom, we will keep them separated from other inmates and contact the health department and go by their rules and by their suggestions.
Okay. Have you seen any erratic behavior from anyone with a lot of anxiety or anything due to this outbreak here in Bladen County?
No, I'll tell you, people in Bladen County have adhered to our request. We made some changes in our office. We've shut down the lobby. We're trying to keep as few people we can from going inside. And when our deputy response call in EMS, we're having the telecommunicator ask them to come outside if they're able to do that. And everybody's doing everything we're asking to do so far. And I think we've been very fortunate with our numbers here because of that.
I know there were a couple shootings in the last couple of weeks. Were those related to this outbreak, do you think, or are they completely separate?
Completely separate.
Okay. And do you foresee any issues with curfews or anything like that? Do we have any curfews in place right now?
We do not. As you know, we have a state of emergency, and I think that Nathan can probably speak this better than I can. He's waiting for direction from the state level, and there will not be curfews until we're really see a need for it. There will not be any curfews in place.
Okay. And there's no shelter in place at this time, right?
No, ma'am.
Okay. Mr. McGee is with the District Attorney. Can you introduce yourself and give us an update from your office, please?
Absolutely. My name is Quentin McGee. I'm the Chief Assistant District Attorney here with the Bladen County DA's office. Just to build a little bit on what the Sheriff is saying and give you a little more context as to what's transpiring with the courts, our Chief Justice, Sherry Beasley, on March 16th, put into effect an order which effectively shut down most court proceedings in North Carolina. There are some exceptions for that, to include individuals who've been arrested to have a first appearance in front of a judicial official. We're still doing those. That's a constitutional protection that's in place, and we're honoring that. So we're still having those in front of judicial officials with prosecutors in court. In addition, there are family courts that are still going, juvenile courts that are still happening on a limited basis. In addition, for inmates or individuals who are in custody, we're still having court proceedings, whether it be probation hearings and other matters, to try to take care of their cases and, where appropriate, dispose of those cases. And sometimes that does result in them either going on to a prison facility or going to probation or what have you. Some of the cases we have, in conjunction with attorneys and other judicial officials, where appropriate, individuals who are held on charges for which they cannot do jail time or prison time. We're looking at those to do unsecured bonds in appropriate places to make sure we save space in the jail for the people who actually need to be there. So that order, as I mentioned, is in effect until April the 16th, at which time we'll await further direction from the Chief Justice as to whether our criminal courts will reopen as they normally do. But in the interim, we have a great working relationship with our sheriff, as well as Captain David Shaw, who's the jail administrator. We speak weekly about the inmate population and ways to work better together to be efficient with what we're doing in the criminal justice system.
Talking about you being efficient, I noticed the other day you weren't bringing in the inmates. You guys were doing like a teleconference. Is that pretty much what you're doing now with all the cases, or how is it working?
Where appropriate, where we can do first appearances where inmates don't have to be transported from the jail to the courtroom, we try to do that. There are certain instances in which if they're pleading guilty to a charge or an offense, then they would have to be present in the courtroom. And so the inmates that need to be brought over, we do actually bring them over when it's needed. But where we can avoid it and where we can do and utilize the video first appearances and things of that nature, we are doing that.
Now, say someone has an issue, a crime has been committed, and they need to speak with a magistrate. Is that office still open, or how will that work? Are you able to do that?
That's a county office that I believe is still functioning at this time. And so if someone had a need for a magistrate, they would still be able to either call, and there's a magistrate on call 24/7, but the office is open at the sheriff's office as well.
So some of those services they may be able to provide over the phone?
That's, if you're, from a criminal standpoint, a person can go and swear out a warrant against another person on a misdemeanor in front of a magistrate. Some of the things that are more pressing would be sort of a 50B,
right, domestic
protection
violence
order.
Mm-hmm.
Those are still being issued, and those hearings are being held. So if folks have those types of domestic issues, the courts are open for them. Those are one of those limited circumstances where the courts are still operational.
Okay. And what about the child abuse cases and things of that nature? Family court, is that still happening?
Family courts are happening. DSS is certainly would be involved as a first contact in those types of cases, but family courts are still operational as well.
Charlotte Smith here again at the Bladen County Courthouse. We are having internet technical difficulties. I think we've addressed those now, and we should not have any further interruptions. We're here with Bladen County officials. We've asked them to introduce themselves as they speak. And Dr. Terry Duncan, Bladen County Health and Human Services Director, had given us an update on the amount of tests that had been done in Bladen County. We have no positives in Bladen County, and she was giving us an update on the respirators. How many respirators did you say the county has?
There are 4 at Bladen County Hospital.
And we're waiting on 8 to be tested, correct? For the test to come back?
We're waiting on 7.
Seven, okay. All right, and the shelter in place seems to be a hot topic right now. The governor alluded to it yesterday whenever he was speaking and asking everyone to stay home if possible. Mr. Dallas, can you give us an update? What should we expect with that? Do you know?
As of right now, there's no guidance from the state on doing a shelter in place. Obviously, if they were in talks about that, I know some counties, you probably hear it on the news, other states have done shelter in place. And there are some counties that have done a shelter in place on their own throughout North Carolina, or put enough curfews and prohibits in so that it kind of limits folks' travel. But as of right now, we've not got any guidance from the state on a shelter in place order, nor me or our admin staff or the sheriff's office talked about any shelter in place plans in Bladen County.
Now, have you been to the grocery stores? How are our grocery stores looking, and the employees there, how are they sustaining through all of this?
So we had some of our grocery stores and Walmart donate some supplies to the school feedings that are going on in Bladen County while me and the sheriff went to go pick those items up that they donated. And we had a conversation with the general manager of Food Line, a very long conversation. And he advised that shipments are coming in daily as they normally do. It's just the demand has grown so much. I think I don't know the exact number, but he said they were at like 156% of quota for the last 2 weeks. And I certainly don't know how their quotas work, but it seems that's a high number if you're at 156%. But he told us shipments are coming in daily. They're encouraging people. They've got limits on certain things. I know he told us rice, vegetable oil, bread, milk, and water. And I want to assure citizens that I know we're accustomed to drinking, a lot of people are accustomed to drinking bottled water you buy from the grocery store. But our tap water in Bladen County is perfectly fine. So if you're running into a situation where you can't find water at one of the local stores or where you normally shop, our tap water is completely safe. It gets tested frequently. So our tap water in Bladen County is fine to drink that. But shipments are coming in, and there is not a shortage on food that we are aware of, nor the grocery stores.
Okay, so there's no boil water warnings in effect. So there's nothing prohibiting any of our residents from drinking the water that is supplied through the county or the towns.
Not that I'm aware of. None of us here work for the water department, but we would certainly be aware of a boil water advisory, and there's none in place that I'm aware of.
And the water and the sewer, are those essential? Like if we did have a shutdown, those are essential workers that we would still be supplied with those services if a shutdown. Do you know if we would be?
Yes. So water, anything that, if we did a shelter in place order, anything that is essential to life, so your grocery stores, water department, utilities, certain industries in the county, would be considered essential, and they would be allowed to travel throughout the county.
Now, I've reached out personally myself with Bladen Online to some of our manufacturers and our bigger industries here in the county. I know some people have mentioned Smithfield and those type of industries that have a lot of employees in one place. Have you reached out to those companies, and do you know if they have policies and procedures in place for the COVID-19 and how they're handling this outbreak?
Yeah, I do know they've got policies in place, and I know I've been in contact with the plant manager, the sheriff has, and certainly Dr. Duncan, but I'll let her speak to what policies that she's heard they have in place.
Okay.
Smithfield and other industries in the county are working under the guidelines, and the environmental control supervisors and his staff have been to the industries here. They are working within the guidelines and doing very well.
And I spoke with Mayor Campbell of Elizabethtown earlier today, and she said that they've been in contact with the local churches about group meetings. And have you guys seen any issues with the large gatherings of that nature, people not adhering to the governor's executive order on large gatherings?
I haven't.
Okay.
I've had several questions about the gatherings and to clarify the gatherings, but I haven't had any issues to point with it.
Okay, just for our viewers, can you clarify what the large gatherings executive order is?
So as of yesterday at 5 o'clock, we know that the large gatherings, you can't gather in mass gatherings of greater than 50 people. And that's regardless of location. It would be a gathering at any place. And of course, President Trump asked us roughly about 10 days ago to have no gathering greater than 10 people, particularly those that were of high risk. And that would be age 65 or older, those folks that have some health issues, heart disease, lung disease, diabetes, obesity has been added to that, and pregnancy.
If the governor does issue a shelter in place, will Bladen County adhere to that? Will we be mandated to adhere to that, and what would that look like?
Well, if he orders a shelter in place, then we're mandated to that, are we not, Sheriff?
Again, Quentin McGee from the DA's office. One thing I would add to what Terry was saying about that order, it does make it a Class 2 misdemeanor to violate that order. So people who are congregating in violation of that order are subject to civil and criminal penalty. So it's something that folks should keep in mind.
Okay.
As far as Bladen County, anything the governor mandates, we will be in support of that. And we will do for him what we hope our citizens do for us, and do what we ask. And hopefully we'll all come out of this okay.
And is there anything else that you would like the citizens to keep in mind during this time to keep safe, Sheriff? Are there any procedures or precautions that we should take just to keep ourselves safe and our property safe?
I do. We need to be more patient. Some people are laid off from work, and that's a stressful situation there. Families are home together all day. Some have been for a week or so, and that's something they aren't used to. So please be more patient with your family members and your neighbors, and try to work out your differences before you call the sheriff's office. And that's very important. We're all going through this together. And believe it or not, every first responder is under the same stress as anybody. So we just have to deal with it and wish for the very best.
Can you tell me again how many inmates were released since the COVID-19 outbreak that you're aware of?
Well, we've only requested 3, and we went to Quentin McGee, our DA, and the bond was unsecured. He saw fit to do that. As far as he might be released just because of this virus, they have not. But as I said earlier, and Quentin realized this, we're trying to keep as many people we can out of our detention center.
Anybody with mental health issues, what should they do for mental health? I know, like you said, is high anxiety. We do have people out of work, which could cause depression. I would imagine, I'm not a healthcare provider or mental health worker, but the stress of the outbreak, what should someone do related to mental health?
Fortunately, we live in a county that does have a huge faith-based population, and certainly would encourage folks that are having stress, mental health issues, behavior health, to reach out to those church groups, as well as there are some online resources. The Department of Public Health has a resource. I know that several of the ministers here are trying to work for some online, such as the recovery groups. So hopefully we'll have some more opportunities in the near future for folks to be able to reach out and reach out quickly.
Okay, yep, and we've published those on Bladen Online, those services, and East Point, our MCO for the county, has said that they are open and their 24-hour hotline is available for access as well. So I appreciate it. Do you guys have anything else that you would like for our citizens to know?
Just quickly, there is a rumor that the WIC program for women, infants, and children, it's a nutritional program that helps to keep that population healthy. There's a rumor that it's being ceased, and it's not. We have available at the health department, and even the program has been relaxed in that now all of the business out has to be done in person. We can do it via phone and via fax. So if you will call the health department number, 862-6900, we will put you in contact with the WIC people, and it is important during this time, and it is stressful for that population. And additionally, just to remind folks that the restrictions that we have in place are not an invitation to go visit your folks in some of the more metropolitan areas that are at high risk, and not an invitation to invite folks to come and stay as well, because we do have people in the county that are going out of the county to places where there are high incidents of COVID-19, and vice versa. They're coming here to us because, I mean, they have been online. We've had a call actually that said, oh, you don't have any cases, and are your grocery stores open?
Okay.
One thing I would add, Charlotte, I mentioned the order from the Chief Justice. If you had a court date anywhere between March 16th and April 16th that was covered by that order, your court date's going to automatically be rescheduled. So the Bladen County Clerk's Office will send you notice as to when your new court date's going to be. I know there's been an influx of people calling. They had a court date, court was canceled. What do I do? When's my next court date? Correspondence should be coming from the Bladen County Clerk's Office as to when your court date is rescheduled. If you don't receive that, if you've moved, you can contact the clerk's office the week after your court date. So, for instance, if you had a court date for today, I would contact the clerk's office next Monday to get your new date.
Okay. All right.
We've had a lot of questions about small business loans and things like that. I think we talked about this on Tuesday when we met, and I'm looking on my phone here. There is a recovery hotline number. I'll tell you that now while we're on air, but we'll also get that number to you. It's all questions pertaining to SCBA. That number, the state has a hotline set up to answer questions for small business loan applications and things that have come out for this COVID-19 pandemic. That number is 919-825-2548. And again, that number is 919-825-2548. And that is pertaining to all SCBA questions for the state.
Okay, great. Well, thank you very much. Thank you all for joining us. You can visit. Okay. All right. Yes. Yes. No, you're fine. Go right
I would be
ahead.
remiss if I missed this opportunity. Folks who have compliance things such as expired registration, expired tag, no inspection, things like that.
Good idea.
Low-level traffic offenses that you've come into compliance on. If you had a no insurance ticket and you now have insurance. Those things you can go to onlineservices.nccourts.org. If you come into compliance, you can request a dismissal on those things online without having to set foot in the courthouse. You don't have to leave your home.
Okay.
Additionally, if you have a speeding ticket that's less than 20 miles over the speeding limit, or less than 20 miles above, you can go to onlineservices.nccourts.org and request a reduction in that ticket as well. And so it may be possible to address your traffic matters without having to come to the courthouse at all. And that's in effect even when courts are running, but it's especially important that the public knows that now.
That's wonderful news. And again, one more time, the website is what?
It's onlineservices.nccourts.org. You will need to know your citation number and also have a valid email address so that the courts can contact you about the disposition of your matter. But that information is found on a ticket.
Okay.
If you receive that. So that's a great way for folks to be able to resolve their issues remotely.
Great. Yes, that's good news. Thank you so very much. And you guys can visit bladenonline.com. We will have the video published there on our YouTube channel, the link and some of these resources that our officials have mentioned linked there as well. Thank you for watching.